Hi, my name's Rachel. I'm one of the physiotherapists based at the Christie in Manchester. This video is for patients who have a diagnosis of breast cancer and who are undergoing their radiotherapy or due to start their radiotherapy treatment. Today I'm going to be talking to you a bit about how radiotherapy can affect the shoulder. We're going to run through some simple exercises for you to do at home in your own time, and we're also going to recap over some lymphedema risk reducing advice. As you're going through your radiotherapy, usually your treatment is targeted and they call it a radiotherapy field, which is aimed at a certain area in the chest and it goes a bit wider. And usually that field encapsulates the front of the shoulder. So we know with radiotherapy, you can get something called a bit of fibrosis. Normally your tissues glide nicely over one another, but as you get fibrosis through your radiotherapy, tissues get thicker and thicker and they become a bit what patients describe as sticky. And that can happen at the front of the shoulder. And because of this, you can lose a bit of range of motion in the shoulder. So this is why it's important to take out some daily exercises to prevent you losing any function and to keep that range of motion nice and healthy. So now we're going to go through the warm-up exercises. So you're going to start with both hands on your shoulders and you're going to take your arms up and down and work through the range of that shoulder. You're going to do 5 of these movements. And once you finish your 5, you're going to bring your elbows forward and you're going to go up and down again with your arms with your elbows pointing to the front. And again, do 5 of these movements. And once you've completed 5 of them, you're going to pop your hands behind your head. So arms coming inwards, so your elbows are going to reach to each other and take them back. Reach to each other and take them back. Again, 5 of these. And the final one, our model is going to stand up to show you, but you can stay seated. You can have your arms behind your back and you're just reaching up towards your bra strap and taking it back to the lower back. And again, 5 of these. Just working through that range. We're not holding any of these movements. So now we're going to move on to the stretching exercises. For this, you're only going to stretch the affected limb. If you get yourself on the floor with the pillow supporting your head, you can have your legs out straight or you can bend them. And we're going to move on to the first exercise. So you're going to have your arms starting off straight by your side. Take it nice and straight back towards your head with your thumb travelling towards the floor. And you want to get to the point where you feel a stretch in your shoulder. And then you can take the opposite arm and give a little bit of overpressure. This is where the hand will just be underneath the elbow. Hold that for 20 seconds. And when you've completed your 20 seconds, you just bring the arm down and give it a shake. We'll repeat that one more time. Take your arm back nice and straight with the thumb going towards the floor to the point where you feel it stretching underneath the shoulder, opposite hand to elbow, a little bit of overpressure. Hold for 20 seconds. And then bring it back down. And you'll repeat that 10 times. And then we'll move on to the second exercise. So your palm is going to face up towards the ceiling. And your arm's going to stay in contact with the floor at all times. You take your arm out to the side and you're aiming for a diagonal with your chest. So if you think of a clock, it'd be either 10 o'clock or 2 o'clock. Again, to the point where you feel a stretch across the front of the shoulder and into the chest. And you're going to hold it there again for 20 seconds and then bring it back down. And we'll repeat that one more time. So palm facing upwards, take your arm out, making sure it stays in contact with the floor at all times till you get that stretch across the chest into the shoulder. Hold for 20 seconds and then bring it back down. And again, you'll repeat this 10 times. So now we're going to move on to the third exercise. You're going to use both of your arms for this. You're going to place your hands behind your head and take your elbows out to the side, like you're sunbathing. And we're going to hold that there for 20 seconds. Again, you should feel the stretch across the chest and into the shoulder. And when you finish your 20 seconds, you can just bring your elbows up, just bounce them a few times, and then take it back down. And again, hold for another 20 seconds. And you'll repeat this 10 times. You should aim to do these exercises 3 times a day. You start with the warm-up and then you move on to the stretches. So with the warm-up, you're doing 4 movements, repeating that 5 times for each movement. With the stretches, you're going to hold each stretch for 20 seconds and repeat that 10 times. And that is 1 session, which you repeat 3 times a day. Most of you have also had some surgery on your nodes, whether it's an axillary node clearance or sentinel node biopsy. This does mean you are at a small risk of a condition called lymphoedema. Lymphoedema is not a life-threatening condition, but it is a chronic condition, and we can take some measures to try and prevent this further. As I said, it is a small risk, but there are things you can be doing daily to prevent that risk even more. Lymphoedema will present, it will only be on the affected limb. So if you've had your nodes removed on the left-hand side, it will only affect the left-hand side. And it's usually a gradual swelling in the arm. If you wake up one day and your arm is very swollen, that is an emergency and should be seen to urgently. Lymphoedema will not present like that. It will be a gradual onset of swelling, usually over a month or 2. Your arm might feel quite heavy, might feel quite tired, and your tissues on the arm might also feel a bit different. Most people notice that their sleeves don't fit as well on one side compared to the other, or if they have rings or watches, they might feel a bit tight. The difficulty is, because you are currently going through treatment, you can also get some treatment swelling. So I'd wait till you finish your treatment, and if you still have persistent swelling, go to your GP or talk to your breast care nurse, and they can refer you to your local lymphoedema service. Our lymphatic system runs alongside our circulatory system. So imagine your blood vessels. We also have lymphatic vessels that run alongside. The role of our lymphatic system is to help fight infection and also to remove any kind of excess waste fluid. Our nodes play a large role in this. If you've had some of your nodes removed, then you are slightly compromised, and this is why it can lead to lymphoedema and residual fluid being in the limb. Most of the time, the fluid that would drain through the nodes that have now been removed will just find another pathway, and we have lots of nodes all around the chest, neck and in the abdomen as well. It's really important that we do try and avoid infection where possible, and you can help do this by maintaining good skincare, which we will talk a little bit about now. There are some things that you can be doing for yourself at home. Maintaining good skincare is really important. With lymphoedema, we don't know who is going to get it and who's predisposed. However, we know that sometimes people who get infections are more likely to develop further on down the line. So our aim is to try and avoid infection in the affected limb. With skincare, I will give you a handout in the post as well, so you should have this while you're watching this video. It's important to moisturise your arm daily. We want to avoid any cracks in the skin. So use a good moisturiser. We sometimes recommend something that's an emollient-based cream, which you can get from your GP. We recommend you do it in an upward motion. So if you start at the top, you're going to do sweeps up your arm towards the shoulder and chest and work your way down in this upward sweeping motion. And that includes your hands as well. So make sure you're moisturising your hands so that you're avoiding any cracks in the nail beds or on the skin of the hands as well. It's also quite important to try and avoid any cuts, grazes or scratches in the arm. You're a human being, it's inevitable you are going to get these. Some measures you can take are things like if you're going to be in the garden, wearing gardening gloves, or if you're baking, wearing good oven gloves, or if you're outside, wearing maybe long sleeves to prevent cuts on the skin. If you do get a cut on the skin, just keep it clean and keep an eye on it. If you do find it's looking a bit red, maybe a little bit infected, contact your GP. Let them know you have had some nodes removed and that you might maybe have a small infection developing. They will usually see you that day and possibly give you some antibiotics, but you can discuss this with the GP. Exercise is really important in reducing the risk of lymphoedema. The lymphatic system heavily relies on muscle pump, so it's really important that you do get some exercise into your daily lifestyle. The government recommend 150 minutes of moderate activity weekly. That is your typical 5 times a week, 30 minutes. And that can be something that just gets your heart rate up. It can be a brisk walk outside, it can be going up and down the stairs. They also recommend doing 2 resistance sessions a week. This can be something as simple as sit to stands from the chair. Because you have had surgery to your arm, there's no exercise that you can't get back to. We do say just appreciate that you have had surgery and that your arm might feel a bit more fatigued than normal. We say look out for these signs of fatigue. So if you're doing an activity, if your arm starts to feel throbby or achy, we just say it means it needs a rest. So stop, have a little rest, and then you can pick up your activity maybe another day or a bit later on. The last part I'm going to talk to you about is weight management. We know that if we carry lots of excess adipose tissue on the affected limb, or otherwise known as fatty tissue, this can act as a resistance for lymph fluid to get back into the main system. Therefore, if we try to maintain a healthy BMI through exercise and diet, the chances are we will reduce the volume of excess fatty tissue or adipose tissue on the limb and allowing that lymph fluid to move more freely back into the system, thus reducing your risk of lymphedema in that arm. If you have any questions regarding the information or exercises we have given you today, please feel free to contact us with the details provided.